In this lecture, I will be explaining the Somogyi Effect and Dawn's phenomena. Both Somogyi Effect and Dawn's phenomena is characterized by early morning hyperglycemia. However, the underlying mechanisms, causes and management strategies are different for each of them. So in this lecture, you will learn about both these phenomena, the underlying mechanisms, causes and how to manage each of these effects. So starting with Somogyi Effect. The figure drawn here shows the blood glucose level from bedtime to early morning. So at bedtime, the blood glucose level is normal, but at night time, there is a period of hypoglycemia, there is a period of hypoglycemic stress, and this triggers the body's counter-regulatory response to release stress hormones such as glucagon, cortisol, adrenaline, growth hormone, and all of these hormones stimulate the liver to release glucose into the blood circulation, and this raises the blood glucose level in the early morning hours. So if you look at the causes of Somogyi effect, high insulin doses at bedtime or insufficient food intake or skipping of evening snacks or meal can cause hypoglycemia during the night time, and this can trigger in response to low blood glucose level. There is rebound hyperglycemia due to the release of stress hormones, and this is because of nocturnal hypoglycemia, which is a characteristic feature of Somogyi effect. So now that you know the underlying mechanism and the causes of this effect, so how do you manage a case of Somogyi effect? So this can be managed by reducing the insulin doses at bedtime and ensuring adequate carbohydrate intake at bedtime so as to prevent hypoglycemia and rebound hyperglycemia in the morning, leading to high blood glucose levels in the morning hours. Let us now see what is Dawn's phenomenon, the underlying mechanism, causes and management strategies. Now the bottom figure demonstrates Dawn phenomenon. The figure drawn here represents the blood glucose level from bedtime to early morning. At bedtime, the blood glucose level is normal, and during the night, typically at 2 to 3 a.m., the blood glucose level is normal, unlike Somogyi effect where there is a period of hypoglycemic stress leading to hyperglycemia in the morning. But in Dawn's phenomenon, the blood glucose level is normal at 2 to 3 a.m. and it gradually increases as night passes and is characterized by high blood glucose levels in the early morning hours. Now this high blood glucose level in the early morning hours is due to physiological secretion of hormones such as cortisol, growth hormone, catecholamines into the circulation, and this raises the blood glucose level. So these hormones cause natural reduction in insulin sensitivity, which means that the body needs more insulin to counter the actions of these hormones or to counter the high blood glucose level in the morning. In a diabetic individual, the body cannot make enough insulin to counter the actions of the hormones that are released into the circulation, and this can cause hyperglycemia in the morning. Also, the insulin that was taken during bedtime, the action of insulin decreases as night passes. So during the morning time, there is low circulating insulin, and this is not enough to counter the high blood glucose levels in the morning. So the management strategy in case of Dawn's phenomenon is to increase the insulin dose, administer the insulin close to bedtime so that the action of insulin continues throughout the night and is able to control the blood glucose level in the morning. So how to distinguish Somogyi effect from Dawn's phenomenon? Check blood sugar level in the night time, typically at 2 to 3 a.m. So if the blood glucose level is low, it indicates Somogyi effect, because a characteristic feature of Somogyi effect is nocturnal hypoglycemia followed by rebound hyperglycemia. Whereas if the blood glucose level at 2 to 3 a.m. is normal or high, it indicates Dawn phenomenon, because in Dawn's phenomenon the blood glucose level is normal and it gradually increases from 2 a.m. to 8 a.m. so that in the early morning hours there is high blood glucose level, and this is due to physiological secretion of hormones into the circulation. So this is how you distinguish between the two phenomena, and regular blood glucose monitoring helps to manage diabetes according to the underlying mechanism. So in summary, what are the differences between Somogyi effect and Dawn's phenomenon? Firstly, in Somogyi effect, there is a period of nocturnal hypoglycemia, and this triggers rebound hyperglycemia in the morning, and this causes release of stress hormones such as glucagon, cortisol, growth hormone, catecholamines into the circulation and raising the blood glucose level. Whereas in Dawn's phenomenon, the blood glucose level is normal in the night time and gradually increases from 2 a.m. to 8 a.m. and this is due to physiological secretion of hormones such as the growth hormone, catecholamines and other hormones. So in Dawn's phenomenon, there is no preceding hypoglycemia unlike Somogyi effect. So if you look at the causes, Somogyi effect is due to high insulin doses and insufficient food intake causing hypoglycemic stress and which in turn triggers hyperglycemia or high blood glucose level in the morning. So the management strategy is to reduce the insulin dose and adequate food consumption before bedtime, and this helps to prevent hypoglycemia during the night time. Whereas in Dawn's phenomenon, the blood glucose level is normal during the night time and gradually increases from 2 a.m. to 8 a.m. and this is due to inadequate or insufficient insulin in the circulation. So the treatment strategy would be to increase the insulin dose, adjust basal insulin, administer insulin close to bedtime so that the action of insulin continues till morning. So with this, we come to the end of the topic. Thank you for watching. If you find my video useful, please like and subscribe to this channel.